Welcome to Ortho Reports. Today we're diving into a really incredible case from the Journal of Orthopaedic Case Reports. We're talking about a high-velocity accident, a shoulder that was, for all intents and purposes, completely obliterated, and a surgical fix that had never, ever been documented before.
So let's set the scene. It all starts with a high-velocity road traffic accident, one of those high-energy impacts that can cause devastating injuries. The result was an injury so complex and so rare that the surgical team couldn't just follow a standard playbook. They had to write a new one right there on the spot.
So who was at the center of this remarkable case? And what does it actually look like when that much force hits the human shoulder? Let's meet the patient and really get a sense of the scale of the damage they were facing.
All right, so our patient is a 43-year-old man, and he's right-hand dominant. Now, the one silver lining here is that the injury was to his non-dominant left shoulder. But the diagnosis, wow, it was a scapulothoracic disruption. And let's be really clear, this is not just a simple fracture. This is a total structural failure of the entire shoulder girdle. The whole system came apart.
To really appreciate the challenge the surgeons were up against, we need to dig into the anatomy of the damage. You know, the word shattered gets thrown around a lot, but let's break down precisely what that meant in this case.
So this term, scapulothoracic disruption, it's basically a catastrophic event for the shoulder. It means you've got fractures all over the scapula, the shoulder blade, plus major damage to all the muscles and ligaments around it. When this happens, the basic mechanics that let you lift your arm are just gone.
Now, here's that silver lining I mentioned. This injury was classified as a type 1 disruption. And what that means is, even though the bone and soft tissue damage was absolutely massive, the major nerves and blood vessels were intact. That was the crucial piece of good news that gave the team a window, a chance to shoot for a full recovery.
This number really tells the story of the structural collapse. The CT scan showed that the shoulder blade was displaced by more than 2 centimeters. Now, 2 centimeters might not sound like a huge number, but in the precise architecture of the human body, that is an enormous gap. It means a total loss of stability. The shoulder's entire framework had failed.
So faced with this unique and frankly terrifying combination of fractures, the surgical team had to think outside the box. They couldn't just pull a standard procedure from a textbook, because one didn't exist. So they created a new one. This is where we get to the really innovative part of the story.
Their solution was just brilliant in its logic. It was a two-part approach. First, you have to restore the structure. Think of it like rebuilding the foundation of a house. They used 2 reconstruction plates to piece the main body and the side of the scapula back together. Then, part 2, restore function. They use a special wiring technique to reattach the broken acromion, which is the anchor point for the deltoid muscle, the engine that powers the shoulder.
And this right here is the headline. This is what makes this case a landmark. While both of these techniques, the plating and the wiring, are known procedures, they had never been reported as being used together in a single surgery to fix this specific combination of injuries. The team was literally writing a new page in the surgical playbook.
So the surgery was groundbreaking, for sure, but the big question is always, did it work? Well, the results, both what you can see on the scans and, more importantly, what the patient experienced, they really do speak for themselves.
I mean, just look at the difference here. The before shot on the left, it's a chaotic jumble of bone fragments. It's a mess. But then you look at the after shot on the right, taken just 4 months later, it's a completely different world. You see stable hardware, perfect alignment, and solid healing. It's a beautiful picture of order being restored from chaos.
But the success wasn't just on the X-rays. These functional scores are just incredible. A 34 out of 35 on the UCLA scale, a 95 out of 100 on the constant Murley. These aren't just good outcomes, they're considered excellent. It means this patient basically got the full use of his arm back. And maybe the best part, his pain was rated a 1 out of 10, almost nothing. And here's what that looks like in the real world. Just 4 months after surgery, with dedicated physical therapy, the patient could actively lift his arm out to the side 120 degrees. That is a fantastic range of motion, and it represents a return to a high level of function for daily life. A phenomenal result after an injury that could have easily been disabling. So this is more than just one amazing success story. A case like this provides a powerful lesson for the entire field of orthopedic trauma. So what's the big takeaway here? What can other surgeons learn from this single report?
The author's conclusion really says it all. For these super rare, super complex injuries, this case lays out a potential roadmap.
The key is to get in there early, be aggressive about putting every single piece back where it belongs anatomically, and then follow it up with a rigorous rehab program. It's that comprehensive approach that makes all the difference.
You know, a single, perfectly documented case like this can literally provide a new blueprint for surgeons around the world. It proves that with a deep understanding of biomechanics and the courage to innovate, even the most devastating injuries might be overcome. It's a powerful reminder that to restore function, you first have to restore anatomy. Thanks for joining us for this explainer.